Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Weekly. And it's an ailment that I believe it's one of the third leading causes of disease in the United States. So, Jane and Roger, welcome to the program. How are you doing this evening?
Doing fine. Well,
and
nice
thank
to be
you.
Back.
Thank you for coming back. Yeah, you were here in May, so this is great to have you back. And we have Ed Salazar as well. You're a respiratory therapist with All County Healthcare?
Yes, I am.
And thank you for coming along as well. So, Jane and Roger, tell me a little bit about how you found out about IPV treatment as an option to kind of be a treatment for COPD.
Go ahead, Jane.
Probably, what was it, Ed, maybe 5 years ago? When
No, it was at least 4.
At least 4 years
Yeah.
ago, I met Ed. I met Ed at a respiratory therapy company that was having an open house, a grand opening, and he was there with this machine. This other company does pediatrics, and they were showcasing it for that population. He met us and discovered that Roger had COPD and arranged for him to have an IPV unit to try at that time. It made a lot of sense, and it worked for him, but we only had it for about 30 days. Medicare does not pay for it, so we had to return the machine, and because they're pretty expensive to buy, so we couldn't just keep it. We had to send it back. And then subsequent to that, Ed and I have become professional and personal friends, and we decided that we would give this another try, and Roger's been using it now for the last 6 weeks, and it's made in his life a big difference. Maybe in somebody else's life, maybe 5 or 10% is not much, but if you're not working with but 10 or 15% of your lung and you can get another 5 or 10%, that's huge. And that's what this has done. That machine tends to open up the faraway areas of your lung that when in normal breathing with COPD you don't get to. And by opening those, and I think Ed's going to address how the machine works, by opening up those areas, it was able to allow him to breathe deeper and have better oxygen exchange.
Now, Roger, what kind of symptoms were you having with COPD?
Mainly just dyspnea, which is I can't get my breath.
Mm-hmm.
So I always feel like I'm trying to take a deep breath, but it doesn't work. So I'm always short of breath, and by using the IPV, it seems like it opens it up, which makes breathing a lot easier after I do the treatment.
Do you feel that in the first treatment, or is it something that's built up over time?
Built up over time, but after the first treatment, I felt better.
Okay, so you're able to kind of exfoliate, get rid of that congestion.
And I put medicine in it, which helps to open up your airways
also. Okay.
Also.
So you can actually add medicine to the...
add medicine right to it.
Okay.
So that helps considerably, too.
And
It's the medicine where it needs to go.
Yeah, definitely. To the lungs and the respiratory system.
I'm on inhalers, and the inhalers, the problem with it is the inhalers don't get down into the deep areas of the lung. So by doing the IPV first and then doing the inhalers, it forces the inhaler down deeper into my lungs. I can notice that difference immediately.
It provides a deeper treatment.
It does.
And Ed, tell us a little bit about the process. So you met Jane and you introduced the IPV machine to her. Now, do you at that point schedule a session to teach Roger and Jane how to use it, or is there a kind of like a tutorial or an education seminar?
There's definitely a tutorial, and technique is very important.
Mm-hmm.
So yeah, but it's not rocket science. Most every COPD patient. How would you describe the severity of your COPD?
I have less than 20% of my lungs left.
And so he is severe COPD.
Severe. Stage 4.
Stage 4, okay.
So, you know, people in this situation, they've lost a lot of their mechanics. You know, the ability to take in a deep breath, the ability to exhale forcefully, you know, some of these things. What we were able to do with Roger is that by recruiting lost lung volume, that's what he was talking about, you're getting to the deep parts of the airway, the most terminal airways, they'll actually collapse, and they can be re-recruited, you know, re-expanded. And once you've done that, then you can also help mobilize secretions. It's, you know, part of a loss of mechanics is the inability to cough effectively. So if a patient starts building up congestion, it's very difficult for him to mobilize it. The best analogy I can give you of how high frequency ventilation works, if you had a big pipe and the inside of that pipe was coated with dirt, right? But down through the center of the pipe now, you're going to shoot quick bursts of water. Pop, pop, pop. Very, very rapid, you know. As soon as it gets to the bottom of the tube, it's going to start filling up, right? And eventually it's going to start washing out. What's going to happen to everything that's on the inside of the
It's going to
pipe?
break apart.
It's going to break apart and it's going to wash out. But it washes out at a much slower rate than it went in because we're shooting a rapid burst through the center. But because you got a lot more surface area, it washes out at a slower rate.
And those secretions that you're talking about, is that pretty much the same as mucus, or is that a different kind of?
No, it's mucus.
So mucus gets caught in the respiratory system and can't get out. So this machine, which we have on set today, and we're going to be doing a tutorial probably right after the break. So that's really something to have the machine on the radio set here. But that's something that breaks up that mucus, and over time, the patient, the individual, is able to kind of exhale, get rid of that mucus.
Yeah,
You cough it up.
The
Cough it up,
interesting
okay.
thing, David, is
It helps you cough.
all
Nice.
he has never had congestion. He does not cough, doesn't have any of those symptoms. But when he started using this machine, he started getting congestion and he started coughing. And what has happened is it's gone to these far out regions of his lungs, opened them up, as Ed alluded to, and broken up what's been there for who knows how long, and is now allowing that to come out, which is cleaning out those areas. So although that little bit of congestion is uncomfortable, by getting that out of where it was, it's definitely going to make an improvement.
I mean, it was just virtually stuck in there until you had this treatment.
Yeah.
And you had already been
waiting
on.
for pneumonia.
Oh, wow.
That's what the pulmonologist says.
Because of the bacteria?
So people
Builds
then
up.
get pneumonia and you have an exacerbation, they call it, and that's most people die from the exacerbations.
Oh, wow.
Or the
You
bacteria
figure-
growing in that mucus.
You figure you've got a dark, warm, damp place with stagnant mucus.
That accelerates bacteria and pneumonia.
So it's critical to mobilize those secretions.
Now, how often during the day do you do the IPV treatments when you're involved with them? You said for the last 6 weeks you've done them?
I do it once a day and try to do it twice a day, usually morning and evening, but sometimes evening is kind of harder to get to, but I do it every morning.
And how long for each treatment does it last for?
About 10 minutes.
So you do 10 minutes straight?
It's quick. It's a quick thing.
And immediately you can, over time, with it building up, you can feel a difference.
I can, and then after that I go walk on my treadmill for 30 minutes.
Oh,
do
wow.
exercise.
Which he was not doing before.
Oh, that's great to hear. So it definitely
It's improved all the way around.
improves the quality of life.
The way that we think we were able to improve his exercise tolerance. Remember I said that the mechanics are difficult to recover? But by reinflating those alveoli, you know, little air sacs down there, and allowing more blood, more gas exchange, we're able to increase his blood oxygen levels. And by increasing his blood oxygen levels, his exercise tolerance improves.
And the PFT test kind of showed that.
Yeah, there's a test it's called diffusion capacity, and it's actually a measurement of the ability of oxygen to diffuse from the blood into the alveoli, and also to get rid of the CO2. You know, the oxygen goes from the alveoli into the blood, and the CO2 goes from the blood into the alveoli. It's an exchange of diffusion. And he had a 27% improvement in that one parameter. And
Over a year period of time. That was at Mayo Clinic when I had the test.
And for a stage 4 COPD patient, that's very significant.
Oh, wow. Oh, that's good to hear.
Because usually you don't see improvement with COPD, as it's kind of a deteriorating sort of condition.
Now, Ed, tell us, we got about a minute before we take a break, and then we're going to try the machine on the other side. Tell us how people can, qualify for use of this machine.
Well, right now, we're working very, very hard to get CMS, Medicare, to approve a billing code. But until they do that, it's the only, in South Florida, the only way COPD patients can access this therapy is through All County Healthcare, because All County Healthcare has invested in 5 of these devices.
Okay, and that's in the Tri-County area of Miami-Dade County, Broward County, and Palm Beach County.
Correct.
As well. Okay, and the website is allcountyhealthcare.com. Let's take a quick commercial break, and on the other side, we are going to do a tutorial with the intrapulmonary percussive ventilation treatment, or IPV treatment, on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor Living a Longer and Healthier show. Living a Longer and Healthier Life show. As I promised, we're going to try out the IPV machine here in studio. So, Ed, tell us a little bit about the machine, and this is going to be the easiest part of the program for me because I'm just going to have to breathe.
Breathe. Oh, yeah, just breathe. The machine, this technology is nothing new. It's been around for more than 30 years, but it was usually just in the realm of critical care, burn patients, trauma patients.
In the hospital setting.
In the hospital setting, right. The people that manufacture the equipment said, well, if it works on the very sickest of lungs, why wouldn't it work on lower acuity? So that's how it made its way, and right now it's most effective with COPD patients and cystic fibrosis patients. Any of your viewers that either take nebulizer treatments or they know someone, they have a loved one that does nebulizer treatments, and they're familiar with that part of the process. So this machine has a 50 psi compressor built into it. Usually when we start the therapy, we'll start it and the patient's getting their aerosol treatment, right? And it's a very, very effective high-density aerosol. Then once they've got the medication on board, like Roger was talking about the bronchodilators and everything, then we implement percussion. Now, a lot of COPD patients are familiar with chest physiotherapy, just
breaking it up.
Okay, right. But with IPV, you're doing it internally instead of externally, and at the same time they're getting their aerosol treatment.
I see.
So this is what we would do with a patient. Mr. DePino.
All right, am I holding right here?
You're gonna hold the cup.
I'm actually
hold it
holding
right
the
there,
device,
Right?
the cup. I don't have to put my thumb there.
No, all you're gonna do is just get a good tight seal on the mouthpiece there, and just breathe normally. So right now you're just getting the aerosol treatment. Right now he's just getting the aerosol treatment. When we throw in the percussor, now what you want to do, you want to take in slow breath in, deep breath in, exhale slowly. Deep breath in, exhale slowly. And the nurses who give the treatments to the patients at home are trained to modulate the frequency and the amplitude to what is most effective. So what I've done right now is I've decreased the frequency, but I've increased the amplitude, the force of the percussion. Ordinarily, the patient, will stay, something like this for, 5-10 minutes. Now I'm going to increase the amplitude a little bit more. Remember the idea: deep breath in, slow breath out. And on the exhalation is when you can really feel. Okay, we're just going to go one more step. We're going to let you out easy. Deep breath in, exhale slowly.
Wow.
Now, take a deep breath.
Oh yeah, you can feel much clearer. Much clearer. It's very, very rhythmic, and definitely can feel the difference already. It definitely
having
feels
a little
like
therapist inside, pounding
and
away.
breaking it up.
Every respiratory therapy that's ever treated a chronic lung patient or a cystic fibrosis patient has had to just endure that. I don't like giving 45-minute treatments.
No, that's got to be a lot on you over time.
And the beautiful thing about this is the machine doesn't get tired, so it will maintain a consistent frequency and amplitude according to where you set it.
Wherever you set it.
Now, what the patients need to do, they need to gradually become accustomed to the increased amplitudes. You don't accomplish anything if you make the patient uncomfortable. So you want to start them at whatever the most comfortable setting is for them, and then make adjustments from there to improve their condition.
It's maybe something they can work up to.
Correct. Mm-hmm.
As well. Now, I'm a little surprised at the size of the machine. I thought for this type of machine, when I read about it, it was going to be humongous on wheels, something that had to be lifted in with a crane. But it comes with a bag and a shoulder strap. And Jane, tell me a little bit about having this in the house. Is it something you can?
It's very easy to have. We actually have a little place in the utility room, and he leaves it on the counter, and he plugs it in there, and he has a chair in there he can use to sit on, or he can stand into it, and it would actually then just fold back up and be put in a cabinet.
So it's very convenient.
Compact, very convenient. Absolutely.
That's fantastic. Yeah, like I said, I was a little surprised. So, Ed, when this was in the hospitals years ago, it was probably humongous, and they've just
some of them still are.
And some of them still are.
But the beauty of this is, the compressor, or in the hospital, if it's plugged into the oxygen outlet on the wall, this sliding venturi is what does the work. So I could actually, I could take this Phasotron, I could take this device, and I could put it on a number of different platforms, and we could achieve the same thing.
When we're in the hospital or emergency room, those are the oxygen outlets on the wall that you see?
Just plug right into those.
Oh, okay. Wow. So this is available for hospitals, home use,
subacute, rehab.
Rehab, I was going to say.
Yeah.
Nursing homes as well.
And remember you had Dr. Robinson on here?
Yes.
He has one of these devices in his rehab center.
Oh, wow. And Dr. Keith Robinson, he was on the program about a month ago. He's your pulmonologist?
He is here.
And what does he think of the IPV treatment and machine?
He recommends it.
He recommends it. It's part of the program?
Yes.
And you see him as your pulmonologist?
One of them. I have a pulmonologist at Mayo Clinic, and I come here for him. He's right up on all the advances in COPD. So
And let me just clarify, that's the Mayo Clinic in Jacksonville, because you're actually a
is.
resident of Jacksonville, both of you?
Yes.
we are.
And you drive down here to see Keith Robinson, Dr. Keith Robinson, once in a while.
We do.
Oh, that's
And to spend
fantastic.
quality time with me and my brother.
Oh, nice. Fantastic. And are you on the advisory board for the Mayo Clinic in Jacksonville
I
as
am
well?
not. No, I'm
Oh,
not.
okay.
No.
Okay, I thought I read that. I had that somewhere in my notes. So let me scratch that
I
out.
think you need to scratch that one.
Well, that's great. Now, yeah, we talked about the convenience of it. Now, let's kind of go back. So this is something that right now isn't covered by Medicare.
It is not. So if we want Roger to continue with this, we are going to have a fundraiser.
Oh, wow.
Yeah, you have to buy the machine.
Mhm.
There's no other option at this point.
Do you think that'll change that, or is there any kind of...
It's got to change. The evidence for the efficacy of the therapy is overwhelming. It's compelling. We just have to get the right ear in Baltimore.
Yeah, because I was reading up about COPD today. It's the third leading cause of death in the United States. More than 11 people have been diagnosed with COPD, but many more may have the disease. It causes long-term disability and early death. And Roger was telling us a little bit about the reasons why as well. Now, this capsule that I was had my hand near, that's actually where Roger can have his medicine put in there.
This is the medicine cup.
And it through that, is that steam or is that
It's an aerosol.
aerosol? Okay.
Right. Now, here's another thing about aerosol therapy. Many, many times when people are prescribed for an aerosol, they get a little tiny device, and they hook their nebulizer to it and they take their treatment. In order to have an effective aerosol treatment, you have to have a stable, very, very tiny, about 2 micron particle size. And I refer to a lot of these nebulizers as converted aquarium pumps. This is a device that's going to give you 30 psi coming into the nebulizer. It's a high efficiency nebulizer. This thing will nebulize molasses. I mean, it'll give you a good, stable particle size at the most therapeutic range, regardless of the viscosity of the medication.
So it's accessing all parts of the respiratory system, wherever those blockages are.
Some patients, in addition to bronchodilators, they have a steroid or they'll have an antibiotic. It doesn't matter what cocktail the doctor wants to put in there. We can nebulize it.
And is this a mainstream use for pulmonologists, or something that it could be a great tool in their toolbox?
It could be.
It could be.
Really.
It's not mainstream yet, though.
No, not mainstream.
I refer to it as the lost art, the lost art of high frequency ventilation.
Because I was a little surprised when you said that All County Healthcare is the only one in the Tri-County area that has this available, and maybe in other parts of Florida as well. Because Jane and Roger,
In Jacksonville, some of the other hospitals do use it. Mayo Clinic is not one of them, but Shands Hospital does, Baptist Hospital does, and they have a unit right in the hospital for people who come in with exacerbations.
and it's being used for peds as well, pediatrics as well, right?
And that's where it really shines.
It's approved for
Cystic fibrosis, sickle cell crises.
Fantastic. Well, thank you so much for telling us about it, Jane and Roger Park. I really appreciate it. And thank you, Ed, for letting me try the machine. And that was
Breathe
great.
well, breathe
Yeah,
well, my
I'm
friend.
feeling good on the You and Your Doctor show, living a longer and healthier life.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions